Hi, this is Dr. Johnny Liu from Doctor's Choice, and today we're going to talk about why healthcare is so expensive. A lot of the companies that we work with will seek out a solution like Doctor's Choice to really try to not only help their employees, but also reduce their healthcare premiums. What we're seeing is that a lot of companies are facing double-digit increases, part of a larger organization on the board, and they simply budgeted 10% increases across the board annually, and that's compounded year over year. And a lot of companies that we're working with are getting 20-30% increases on their healthcare costs across the board. And people are just shrugging it off like, oh, it's just, it's inflation, it's normal. And what I find is that in any other market, this would not be normal. So imagine if consistently your phone bill went up. I know sometimes it feels that way, 30% every single year. That means that every 2 to 3 years, your costs double. And double again, and double again, double again. So if you can find an investment that compounds at 30% year over year, that's gonna make you a multimillionaire in no time, no matter how much money you have. So why is it that healthcare costs are skyrocketing? From our perspective, we see 3 big trends happening, and I think we're gonna hit an impasse because things are getting unaffordable. A lot of companies are saying, well, it's either I've got to really cut back on healthcare, really change things around, or I'm gonna have to let go of some employees in order to fund healthcare costs. And what we see is a big trend in small doctors' offices, small physician groups going away. Small physician groups, it's been hard for them to stay in business because with negotiations with insurance companies, small physician groups really don't have the power to negotiate against the insurance companies as some of the big guys. So what happens is that a lot of small physician groups will roll up into big hospital organizations, and it becomes a funnel because what happens is that these big hospitals cost a lot of money, they have a lot of infrastructure, and when you only have 1 or 2 hospital systems in any given location, they really have a monopoly or oligopoly on pricing. So the insurance companies have to work with them if they want to stay in business in that area. So small physician practices will roll up into hospitals so they can negotiate together. And that a lot of times adds huge infrastructure costs. And then also the other trend of why small physician practices are rolling up into these large hospitals is also because it's unaffordable for a lot of physicians' offices to stay in business because these are small businesses. They can't oftentimes pay as much as the big players because they don't get payments from the back end. They don't get a lot of these incentives that the big players get. And the cost of labor has skyrocketed over the last 3 years, especially with the pandemic era. What you saw was the entry-level positions. A lot of these doctors' offices, it's 1 or 2 docs. They have an office manager. They have a couple billers, coders. They may have a few CNAs. They might have a few more admins. I know that certainly when I was in a training and I was in a primary care office, it was 2 docs and 3.5 office staff. And the office staff, they were entry-level folks, office managers. They were making, $40,000, $50,000, $60,000 a year, and front desk admin, they might be, $18, $20 an hour kind of folks. And a lot of times with those positions, there's high turnover, and it's high turnover. Then there's training costs. Replacement costs can be upwards of 25-50% of the cost of that position. And what happened with the pandemic was that with the tax credits, with the stimulus checks, and also with bigger companies getting more money, the cost of entry-level positions went up by 15-30%. So a company that has small margins, small businesses, they can't compete with, somebody can say, I can, CNA can say, I can, hurt my back lifting patients all day, or maybe I can work from home for a call center, or even work at Starbucks for $20 an hour plus benefits. So what are you gonna do? You're really gonna go for a position that's gonna have better working conditions or have higher pay. And because of that, small physician practices are not able to stay in business. I was talking to a good friend of mine who's an orthopedic person. He's been in business. He's the 2nd generation. His father was an orthopedic doctor. He's an orthopedic doctor, and he's seen his income go down every single year for the last 20 years. His father used to have these big car collections, and they were doing very well for themselves. The office staff was happy. They got a lot of perks, but what happened was he couldn't keep his office staff. Everybody was finding a better position. They were getting, $5,000, $10,000 sign-on bonuses, so forth. And because his margins were going down because he was a small practice, he couldn't negotiate with these big players. his pay was going down every single year. He couldn't afford to keep his office staff, and what did he do? He sold to a big hospital system. And now that big hospital system has the clout and they're negotiating with insurance companies, and the hospital systems, their costs have gone up because a lot of these hospitals, they run on entry-level positions. Again, the same type of positions, the admins, the CNAs, and so forth. And those positions with 15-30% increases, the hospitals have thin margins, even though they make billions and billions of dollars in terms of income or in terms of revenue. Their incomes are very low because of the infrastructure costs. So they pass that on into the insurance companies, and you have these impasses going on. And that's why you're seeing healthcare costs go up by 15-30%, because insurance companies really have two routes to pass on the cost. They can either pass it on to the direct consumer, ACA plans, or they have to pass it on to employers. And a lot of times with the ACA plans, with Medicare individual options, they have to rely on the government, and the government a lot of times dictates what their reimbursements can be, especially on the Medicare side of things. So there's not a lot of flexibility, although it can be very profitable. So employers, especially the mid-market or small employers that don't have the negotiating power with the insurance companies, everybody says, oh, it's for patient care. It's kind of like the startup world where no matter what, you have to add, oh, it's to make the world a better place. You can develop this app that sees hot dogs versus other things, and it's like what do I need this app for? It's like, well, it's to make the world a better place. Just like in healthcare, where anytime things are really about money, they add the term, it's for better patient care. I don't know if any of this stuff adds to better patient care in terms of the way that things are going with negotiations, but that's why things are going up. You have high increases in base labor, and then you've got high increases in turnover, and then high operating costs, and then also a lot of the funding, the pandemic era funding, that's being pulled. So you sort of have this trifecta of increases in costs that's being passed on to the consumer, and a lot of times the employers are the ones paying for it.